Hello, I'm Arthur Crafton. In this informative program, you will learn how dental implants and restorations anchored by dental implants can amazingly change your quality of life. And the team that can make it happen, David and Associates. In this show, we're going to learn about all the latest procedures offered by David and Associates to denture wearers to help them look better, eat better, and feel better about themselves. We're also going to meet some incredible people whose lives have been improved by David and Associates. We'll learn about the easiest and most affordable ways dental implants can help you, and the sophisticated ways dental implants can give you back fixed teeth in about 1 hour. And what's also exciting about all these procedures is that they can all take place right here in this one office.
Well, I first got interested in dental implants about 20 years ago. So when I first started, it was really just myself. So when a typical patient would come in, they would see me. I would give them a general idea if we could do dental implants, and then I would refer them to a specialist in a different part of town. So what would happen is the patient would have to make another appointment in a different part of town. That might take 3 or 4 weeks to get an appointment. The patient would then see the different specialist, and then maybe 6 weeks later, the specialist and myself is communicating if it's possible to do this case. So as my practice got larger, then I brought an oral surgeon and a periodontist in the practice that had years of experience doing dental implants. Later, I brought an in-house laboratory technician in so that I could actually fabricate the restoration. So what's nice now is when the patient comes in, we can actually bring the specialist in, the restorative dentist in, the laboratory technician in. We can all team together and figure out what's the best restorative plan for the patient. And it saves a lot of time for the patient where they're not going all over different parts of town, and it saves a lot of time. We can actually save a patient a lot of times, 6 weeks to 2 months just by having everybody in-house. And now, obviously, depending on what procedure you can do, we can do, a teeth in the hour fixed bridge procedure where we can literally now place the implants in the fixed bridge in 1 hour. Or we can do a nice custom denture, and we can have the denture done and the implants in about 2 weeks.
Today, there are so many new and exciting ways to help people with dental implants, such as fixed bridges and custom Swissadent dentures, both anchored by dental implants. The developments are a welcome answer to studies showing problems associated with traditional dentures may negatively affect the ability to chew food.
Yes, they've done some very sophisticated biting studies with dentures, and the best fitting denture gives you about 25% of the chewing power of real teeth. And that's if everything goes perfectly. If you have optimal bone height, the denture is done, just the way it's supposed to be. But what a lot of people don't realize is when you get your first denture, it only gets worse, because when you extract the teeth, what a lot of people don't realize is that when you chew, the roots in the bone, actually, there's force that's sent out when you chew that tells the body to keep remaking the bone. So after you lose the teeth, there's no stimulus in the bone, so the bone starts going away. The other problem is that that remaining bone was never meant to have a hard plastic or a denture squishing or compressing the bone. So what happens is that when we make a denture and then we put the denture over that soft bone, from that day the bone starts going away even faster. So typically what we see is we'll see a patient that's had a denture done, and about 10 years later, sometimes 5 years later, maybe 2/3 of the bone is already gone. So they started out maybe with 25% of the chewing power. So then when they see us where they're really having problems chewing, they're down to maybe 10% of the chewing power of their natural teeth. And that's what's so nice about dental implants. We can keep it really simple and do as little as 2 implants per arch and really give you tremendous chewing power, a mechanical retention where we can lock the denture in, or we can do some more sophisticated procedures, or we can literally give you back fixed teeth again.
The dental implant actually serves as an anchor for dentures.
Especially when you lose a lot of bone, on the lower arch especially, you can get a lower denture where you basically have flat plastic on flat bone, and no matter how much denture adhesive you use, this denture is not going to stay. So what's really nice is if we just keep it simple and do as little as 2 implants basically in the area where you have your canines, we can retrofit your denture and make this denture totally anchored to your jawbone where it doesn't move. And you can virtually chew any kind of food you want to chew with this. I'd say about 90% with 2 implants, or we can take you back with a fixed bridge and literally give you back the same chewing power of your natural teeth, depending on what procedure you do.
Larry Barthelemy was fighting a problem with lower dentures. He took that problem to David and Associates.
Actually, I came in because I was having a little problem with my teeth and didn't quite like the way they looked.
Larry's dentures were old, worn, and unattractive, and that wasn't all.
When I was eating, I always seemed like I got pits underneath my lower teeth. They were moving around, and always using your tongue to kind of clean out from underneath it. It's kind of embarrassing when you're in public. And then, like I say, I didn't care too much for the way they looked. Even that old man looked the way my mouth closed.
Larry's a believer in punctuality, and when he showed up for his very first visit,
Well, actually, one thing that really got me when I first came in is I had an appointment, and the appointment was right on time. That's a big thing for me. And they ain't getting in the back and real friendly. Told me exactly what was going to happen, how we're going to take care of it.
Dr. Joel David fitted Larry with a custom lower denture, fixed solidly in place by implants.
You know, that's the hardest thing in dentistry to make is a good lower denture, because at least with an upper denture you can get some suction, but with a lower denture you virtually never get any retention or suction. So I'd say nationwide 70% of all the dental implants done are done on the lower arch because it's so hard to wear a lower denture. A simple, affordable way to really drastically increase the mechanical retention or your ability to chew with a denture is just to place 2 simple implants. Our surgeon can actually place 2 implants in about 30 minutes. So if we have your new denture made, or if you're pleased with your old denture, you can come in and see our surgeon in about 30 to 40 minutes. We can place 2 implants. Now with the new generation of implants, which is exciting, is instead of having to wait about 4 months for the implants to fuse to the bone, most of the time now we can actually hook to these implants the same day. So what happens, because everybody's in one office, our surgeon in about 30 to 40 minutes places the 2 implants, and then we can retrofit your denture from the underside with special attachments that are going to plug into those dentures in about 30 minutes. So anywhere from about an hour to hour and a half, we can take somebody that virtually can't chew with their lower denture, and we can anchor that lower denture where it doesn't move.
The Swissadent Elite implant enables Larry to chew better and feel better about himself. What can he eat now that he couldn't enjoy before?
Oh, steaking, corn on the cob, you name it. Definitely do some chewing now.
Larry couldn't resist putting his new dental implants to the apple test.
I tell you, it's different. Different. Not play talk with my mouth full. Yeah, a lot easier to bite. A lot easier. You don't have to worry about it getting underneath the plate.
No food's getting out of there?
None whatsoever. This is really nice.
Larry and others know from their own experience at David & Associates that the dental implants they received made them look and feel better about themselves, not to mention being able to eat and enjoy foods that had been off limits. They're ecstatic, and they let Dr. David know how they feel.
It's been an amazing reaction. It could be, actually, I get the most response from, true dental cripples on the bottom that have no bone. They've been wearing a lower denture that no amount of adhesive will keep it in. And they basically had no idea you could come in for about an hour and a half and totally solve the problem, go out and literally chew with this and almost eat any food you want to eat without the denture moving.
Jacqueline Williams received Swissadent implants for upper dentures. What's the difference between these and lower dental implants?
Well, it's really the same thing. What's funny, we have a lot of patients that come in that think their upper denture is fine, and they come in and have us do 2 lower implants. What happens is after they can generate all this extra biting force from their lower denture, they realize how much they've lost on the upper denture, so 3 months later or 2 months later they come back and they want implants on the upper denture. So we can do the same thing on the upper. We can keep it simple and add as little as 2 implants and add tremendous chewing power, but what's really exciting on the top is that if we add 4 implants, we can totally cut all the plastic out on the roof of the mouth. What a lot of people don't realize is that about 50% of your taste buds are on your tongue and about 50% of your taste buds are on the roof of the mouth. So we have a lot of patients, what's really exciting is when we're able to do 4 implants and cut all that plastic out, they can taste food, way better than they've been able to for years. And when we place 4 implants, that will virtually give you the same chewing power of natural teeth. That restoration just flat out won't move. So that's what's really nice about the top, and it'll also keep the bone from going away. So you get the immediate benefit that the denture doesn't move, you can chew like real teeth, but by that restoration plug into the implants, you won't become a dental cripple 10 years down the road because those implants will keep the bone from going away. If you consider that, if you have a complete denture and you're only chewing with about 25% of the chewing force of your real teeth, and we have the technology very easily to get you back to, almost the same chewing power, it's nice to do just the lower, but if you get this tremendous increase in the chewing power on the lower, what a lot of people quickly want is the same chewing power on the upper. And what's nice about the 4 implants is that we can take about 70% of all that plastic that covers the roof of your mouth off and make a very small restoration that's almost the same diameter of natural teeth.
Jacqueline can't believe the change in her quality of life.
Because right now, I can eat a steak if I like. 6 months ago, I couldn't eat steak. I was on a soft food diet, so this is wonderful for me.
Jacqueline can actually taste her food, something else this innovative procedure allows. She and others who've had the procedure absolutely love it.
I'm having fun. I'm having fun with mine. It gives me more self-confidence. So I'm enjoying them.
Miss Perry?
Marlene Perry's story is a little different. She began wearing dentures as a teenager because of an accident. She was self-conscious about her looks and was considering lip surgery.
When I came over here and started talking to the doctor and other people that I knew that had considered having this done, and one person that had it done, she said, you know, it will make a difference in your smile, it'll make a difference in your features. And I said, well, if it'll make me have more, you know, lips, and then that would be great. I could, you know, kind of kill two birds with one stone. So I went ahead and done it, and it was even better than what I thought it would be.
Marlene received upper and lower Swissadent dental implants and custom dentures. Marlene sings at church. She was nervous that her new dental implants and dentures would not only be difficult for her to get used to, but might also affect her singing.
But it turned out really well, and everybody just really liked it, and singing up in front of the church, it gave me a chance to see if anybody thought it would be unnatural, or if it looked better, or if it didn't look better. So and my pastor, he just really encouraged me on that. Everybody just noticed that it was just such a big difference in my looks. Everyone said I looked 10 years younger, which was really, really nice to me. I thought that was great.
Marlene says David and Associates made her feel special.
I really don't feel like a patient so much as I've been here enough now that I feel like a part of them. They know who I am without me telling them my name, and that's really great. Makes me feel good. Makes me feel confident when I come in here.
Things have changed for Marlene.
Eating is better, tasting is better, food is better. The security of them not falling or losing them or anything is wonderful. And so it's just been a blessing to me all the way around. I've enjoyed it, and I've enjoyed what it's done for my looks too. It has changed my life altogether. From not just mine, but people around me too. They've learned to even act differently around me, because you know, they compliment me a lot more, and they say you really act a lot more natural and not as fearful of being around people than what you were. So that's been great for me. It's been wonderful all the way around. It changed my life completely.
This is John Reed. John wore traditional dentures and longed to go back to the time when he had his own natural teeth firmly fixed in place. I guess it's safe to say anyone who wears dentures feels the same.
That's really true. We have two exciting techniques where we can really get patients back very quickly to implant-supported bridges that are totally permanent and look just like real teeth. The most affordable way, it just really has been out for about a year, it's called All-on-4. What's exciting about that technique is that when we normally do an implant-supported bridge that doesn't come out of the mouth, it usually takes around 8 implants, sometimes 10 implants. With this new technique, they found out if you place the implants at certain angles, you can get by with 4 implants because they're specially designed implants that are a lot stronger. What's also nice about this technique is that with the new generation of implants, instead of waiting on the top arch, for example, it used to take 7 months for the bone to fuse to the implants, and it used to take 4 months on the bottom. So what's nice now with these implants, they're so strong, we can actually hook the restoration to them the same day we place the implants. So on this technique, on All-on-4, it saves usually about 4 implants, which reduces the fee by about a half. And we can also generally have this restoration done in about 9 days to 14 days. Until just about the last year, when we would do a fixed bridge, it would take us anywhere from a minimum of 6 months to a year, and it would take almost double the amount of implants. And now with this technique, we can basically use about half the amount of implants, and we can have you in a fixed bridge in about 2 weeks. It's a very exciting time in implant dentistry.
John knew he'd taken a step in the right direction when he showed up for his initial visit.
And he said, we do it all right here. And then I felt really comfortable, and the more I talked to him, the more I felt comfortable with him, and it really paid off because he went that extra mile. He spent all the extra time.
John took advantage of innovations offered by David and Associates that have opened the door to the amazing All-on-4 procedure. He says he's a lot happier now.
I'm able to eat foods that normally I couldn't eat. Reflects on your whole attitude and personality, sense of humor, everything. You know, I feel like a changed new person.
And talk about positive patient feedback.
Well, you know, first patients are telling me they just couldn't believe that they could actually go from a denture to a fixed restoration in 2 weeks. So that's what's been pretty amazing. And then the feedback, literally like 2 or 3 days as I'm doing post-op visits on the patient, is that, you know, they're eating with this restoration and they have a fixed restoration just like their natural teeth that doesn't move. I mean, you can eat corn on the cob, ribs, steak, and you can eat this where literally a week ago or 2 weeks ago, you literally couldn't eat this kind of food. That's what's amazing. That's what they're telling me.
John likes to tell people about his new life and his experience at David and Associates.
When Dr. David comes in, you know, it's like you're really not at the dentist office. You know, you're sort of like sitting in a chair at the house, and real pleased with everything. It's unlike any dentist office I've ever been to.
Bruce Thompson took advantage of the innovative all-on-4 procedure to take care of what he called a lot of problems.
I decided to get the procedure done because it's a permanent fix, looks good, and it's closest thing to a natural, you know, your teeth they can get. So I decided to go with the implants, and I'm very happy.
Here's another reason Bruce, John, and others who've discovered all-on-4 are thrilled with their implant-supported dentures.
Don't come out, they stay in, and they're basically good for life.
Bruce says he's grateful for the service, the vision, and the people of David and Associates.
So I'd like to say thanks to Dr. David and his staff.
Lots of other people are talking too, including Jan Durand. She took a history of problems and discomfort to the offices of David and Associates.
I've had trouble with my teeth for years and years. Since I was like 35 years old, I've had false teeth. And I have never, ever had a good fit. Either the bottoms didn't fit or the tops didn't fit. And as a matter of fact, I think it was part of my getting IBS. You know, I wasn't chewing properly. I couldn't eat a sandwich like a normal person. It was always breaking it in little pieces. And then I heard about Dr. David.
And Dr. David talked to Jan about an astounding procedure that would allow her to receive teeth in an hour, something that sounds almost impossible.
Well, you know, when I first heard about this, I thought it was impossible too, but it's one of the most amazing procedures. I've been in dentistry 25 years, and we've never had any technology like this before. When we typically make a denture, what we do is we get to a stage where it's called the wax try-in, where it looks like the finished denture, but it's in wax, so we can change, you know, if the midline's off or we want to change the length. So all we have to do with this new procedure is we pretend like we're making a new denture. We get to a wax try-in stage, and once the patient approves the aesthetics, instead of making a real denture out of it, we make a clear duplicate of this denture. We send this to a lab in Sweden, and we also take a CAT scan before we do this. Now what's amazing, in about 5 weeks, a beautiful lifelike bridge comes back from Sweden, but also what comes back is a surgical template. So for the first time, we can do minimally invasive surgery on dental implants. Now what that means is that with this surgical template, it precisely fits in the mouth like a denture base, and instead of having to use a scalpel or lay sutures or flaps, this template will tell us exactly where to drill for the implant. So with this surgical template and the bridge being pre-made, we've been averaging anywhere from 40 minutes to 60 minutes, and we can place 8 dental implants and have the restoration in less than an hour. So if a patient's telling us, you know, that speed is optimal, they want the least amount of discomfort and swelling. What actually causes the swelling and discomfort is taking a scalpel and pushing the tissue back when you lay a flap. So with this new, by using a CAT scan and using a surgical template, we don't have to lay a flap, we don't have to place any sutures. This procedure almost causes no discomfort. So what's amazing is in 1 hour, we can go and place the implants, put the bridge in, and you can go out that night and eat with it.
I couldn't be any happier. I mean, it's totally changed my life. It really has. It's just totally changed my life. I want to smile. You know, I want to show them off now.
Teeth in an hour. Not only is this procedure faster, it's safer.
It's got full FDA approval. Actually, almost everything in medicine is going to minimally invasive surgery. You know, if you have arthroscopic surgery, you're trying to do very little incisions, so the tissue heals a lot faster. So by the use of a CAT scan, it's the first time where we know where the sinuses are, where major nerves are. It makes the procedure way safer because we know exactly from the CAT scan where major nerves or tissues that we don't want to hit. So by having this surgical template made, It makes the surgery a lot faster, but it's way safer. So this is really, almost everything in dental implants is going to this where we use a CAT scan so we know exactly where we're supposed to drill, because it makes the procedure so much safer. It's nice to be faster, but it makes it way safer.
It just feels so good being able to eat like a normal person and being able to eat in public like a normal person, you know, without worrying about them slipping or sliding. And it's just changed my whole life. It really has. Got me on a diet to make everything, you know, just makes you just feel good all over.
At David & Associates, everything is in one place, under one roof, and that was important to Jan.
It definitely makes a world of difference. And Bob, the lab man, being right here, you know, that one of my fillings fell out once, and you give him a call and make an appointment right away, and it's fixed. It's not like you're going without teeth for 3 or 4 days, you know. No, the convenience is absolutely it's great.
So is the personalized attention.
It's a personalized, it is one family, you know. How many patients do you see bringing in cakes and pies to your dentist and the staff just to show some appreciation?
This amazing procedure has changed things for Jan.
This sounds a little dramatic, I think, but it's just the whole aura about everything. It's just more self-confidence, you know, walking in and, hi, how you doing? And showing those pearly whites.
It's been an amazing response. You know, the same way, it's basically people that have been wearing dentures for a year. They've forgotten, you know, what it's like to chew with natural teeth. They don't feel secure in business or social situations that, you know, that their denture is going to move. And then all of a sudden, with a few preliminary records that are sent to Sweden, they can come into the office in 1 hour, walk out with a fixed bridge that's virtually the same, you know, chewing power of their natural teeth. It doesn't move, it's totally retentive, and it's just like natural teeth.
The philosophy at David & Associates is multifaceted. Staying ahead of dental technology and offering innovative procedures and treatment are certainly important. But for everyone at David & Associates, it all comes down to making a difference in the lives of the people they serve.
People feel like whole again, like they're, you know, back to their normal selves, you know, so, you know, they feel better physically because they can eat their food the way they're supposed to, but I think psychologically they're just excited because they have fixed teeth that don't move, and they go out in public and know that they look really good, they can chew their food really well, and most people, they come back to, you know, like the first week they get the restoration, I get more phone calls or people just coming in to thank me that, I mean, it's been like 20 years I haven't been able to eat a steak, and then they go out. I had actually one lady, she went to Outback, and it was like she came back and she surprised me because she grabbed me, almost tried to lift me off the ground because she was so excited that she couldn't eat a steak. And this is the first time in years she could eat a steak again like she could years ago. So that's really exciting when you can do something like that. You know, it's just being able to chew well again, to be not embarrassed in social situations. You know, people, I don't wear a denture, but you don't realize what you lose when you have to wear a denture. It doesn't look like real teeth. They're always like closing their, you know, lips over their teeth, and they haven't been able to eat food properly for years. So that's what's really exciting. They come in and, you know, like a, you know, patient yesterday, she's, you know, made me about 10 cakes because she's so excited about, you know, she's been able to chew like normal again, which she hasn't been able to do for years. You know, another patient where the husband came in and just took me aside and told me how, you know, he was really appreciative that it just totally changed how his wife, you know, feels about herself. I did the same procedure on my mother. You know, my mother was a total dental cripple. She had no bone on the lower arch. I mean, she literally couldn't eat her food. She had a denture when she was young, and at that time there was no such thing as dental implants. So, you know, my mother's just told me over and over again, that's the best thing I've ever done for her because she's got lower real teeth again that don't move. So it's been very gratifying.
The innovative procedures at David & Associates are, in essence, giving many people their lives back.
It truly is. They're going back to a time when they had their natural teeth. We have a lot of patients typically, and they might be in their 60s, and they went 20 years where they couldn't eat food properly. And it's really nice now with some of these all-on-4 procedures or teeth in an hour in a matter of weeks. They're literally chewing their food like they did in their 20s when they had their natural teeth. And that's what's exciting. People come in and they are just, I mean, totally excited when they come in a week or 2 weeks after they've had these restorations done. And that's what they consistently tell me. They just can't believe how much they've missed chewing food, or they can go to church and sing properly or talk properly, not worry about this piece of plastic falling out of their mouth. I mean, it's just, we do a lot of different procedures. We're a multi-group specialty practice, but I don't think there's any group of patients that have, had more gratitude when people that have been wearing dentures for years that can't chew properly, just their level of excitement when they come back in and they said, I feel like I have my real teeth back, and I haven't been able to have the feeling of my real teeth for 20 or 30 years. That's what's amazing.
In a very real sense, lives are being changed.
It has changed my life altogether. From not just mine, but people around me too. They've learned to even act differently around me, because they compliment me a lot more, and they say you really act a lot more natural and not as fearful of being around people than what you were. So that's been great for me. It's been wonderful all the way around. Changed my life completely.
Because right now, I can eat a steak if I like. 6 months ago, I couldn't eat steak. I was on a soft food diet, so this is wonderful for me.
Yeah, I believe now I could eat a steak, corn on the cob, and even apple.
I decided to get the procedure done because it's a permanent fix, looks good, and it's closest thing to a natural, your teeth they can get. So I decided to go with the implants, and I'm very happy.
This sounds a little dramatic, I think, but it's just the whole aura about everything. It's just more self-confidence, walking in and hi, how you doing, and showing those pearly whites, and it's just made a tremendous difference. It really has.
Eating is better, tasting is better, food is better. The security of them not falling or losing them or anything is wonderful. And so it's just been a blessing to me all the way around. I've enjoyed it, and I've enjoyed what it's done for my looks too.
So there you have it. You've seen details about some of these new and innovative procedures that David & Associates offers. Visit the website drjoeldavid.com. You can learn all about these procedures in great detail. And give Dr. David and his staff a call. They'd love to talk to you if for any reason you're unhappy or uncomfortable with your dentures. Maybe you would like to have fixed permanent teeth again. So visit the website drjoeldavid.com and make that call to David & Associates today. I'm Arthur Crofton. Thanks for watching.